So in one of our last blogs, we talked about gait changes, right? And how speed equals stride length times stride frequency. Some of the things we're looking for as therapists and trying to not necessarily get you to forefoot strike, but get your foot to land closer to your body to be able to decrease some of those forces on the shin and the knee. So the question posed was, does your running form play a role in shin splints? And the answer is yes, they definitely can play a role in shin splints. Because we know if we're landing further away from our body, then we're putting more stress through the front part of that shin. We've got a greater foot inclination angle, which can lead to more stress on those muscle groups on the front of the shin. So let's just kind of take a look here. Do a whiteboard. Okay, so if we just draw this out, let's just say this is our body. Say this is our leg landing in front. Here's the ground. And if we are landing like that, then what we're doing is we're actually applying more force to the front of the shin. So what we're looking for as therapists is we're looking to see, okay, this mark here, middle of the body, how far apart are those two, right? So if we can get that closer, let's see. No. So we can get that closer to this direction, then we know we can decrease the force. Because right now, this is putting a lot of force on the front of the shin. The other thing that we're looking for is we're looking to see what this angle is here. And that angle, as it increases, typically means that the shin is not vertical up and down, and you're a little bit further away from the body. So what we can do here, if we just try to erase some of these things, that one there. If we can get this position that we were at, and to change it to this position, it's not perfect, but that will help decrease some of that force at the shin, right? So we can see that shin is more vertical, that angle here is less, which in turn should put less force on the front of the shin. So there are a lot of different things that go into your shin splints, right? And there's multiple different injuries that actually can present that people think are shin splints. But in general, if you are having that discomfort on the front of your shin, more in that muscle belly, not that point tenderness on the bone. Again, that's a common misconception. People a lot of times think that start of a bone stress injury is actually shin splints, but a lot of times shin splints is actually within the muscle groups. But if you're having some of that, changing your gait, changing your form can actually give you some benefit and some improvement in symptoms. And it can be short-lived, but if you're able to decrease the force at the front of the shin, that can help keep you running while we go into the next phase and start addressing some of those muscle issues. So today, just focused on continuing to demonstrate this picture, continuing to show that improvement in shortening up that stride, getting it closer to your center of mass, closer to the body, keeping that shin a little bit more vertical can help decrease that force at the front of the shin, help decrease some of your symptoms, keep you running. Next step, stay tuned for the next kind of episode of this discussion on shin splints. We're going to talk more about the strengthening exercises that you can do to decrease some of these symptoms.